This is Dr. Russell Blaylock, and you're listening to the Blaylock Health Channel. Now, aluminum's the third most common element on the Earth. It's always found in chemical combinations with other metals in nature. Our exposure to free aluminum results from numerous industrial and household uses of the metal. It's very common. There was an explosion of the use of aluminum in products occurring many decades ago. It is not considered an essential element in biological systems, and this is a source of great confusion. There's no biological need for aluminum. It is always a contaminant to biological systems, that is, the body. And even in very small concentrations, it appears to have toxicity. It is not found in countries that are poorly developed, generally, that are not eating the westernized diet and exposed to the industrial contaminations that those of us who live in these developed nations are exposed to. So this indicates that, in fact, this is an environmental toxin. The sources of aluminum, in addition to fluoride industry, is aluminum sulfate. Aluminum sulfate is used to treat public water supplies. It's very active, combines with things that precipitate out particulate matter in the water, and it's used to clarify the water, to make it clear. Unfortunately, it also binds very tightly with fluoride, so you get this aluminum fluoride complex. We also see it in many foods. So if a plant is grown in a soil that has a high aluminum content, it's taken up into the plant. The acidic plants tend to have higher levels of aluminum than non-acidic plants, things such as cranberries, rhubarb, apricots, cabbage, and apples. If you add baking soda to this, it'll release most of this aluminum into solution. The major sources of aluminum are processed cheeses, teas, particularly the black tea. There's very little in green or white tea. Some herbs, spices, and some commercial salts. For instance, they used to put aluminum in salt to keep it from forming clumps in the salt shaker or the salt container. They've taken the aluminum out in most of the commercial salts today. Aluminum utensils can have the aluminum leached out, particularly when you put it in contact with acidic foods. For instance, if you're eating a tomato sauce that has vinegar in it or tomato ketchup, it'll leach the aluminum out of the utensil and deposit it in the food. Another source is aluminum colanders. If you're straining the pasta, the water from the pasta, the aluminum colander will leach out the aluminum into the pasta and contaminate it. One of the sources that particularly is common is the use of aluminum foil. If it's used in cooking, of course, a considerable amount of the aluminum is released into the food. One of the things I see very commonly is that when people are eating out in restaurants and they want to bring home their leftovers, often the restaurant will put it in an aluminum container, or they'll wrap it in aluminum, particularly with things like barbecued ribs. You'll see them wrapped in aluminum. So this is a source of contamination as well, and I would recommend that if that happens, quickly get it home and put it in a glass container. Now, aluminum is also used in industry, for instance, the bauxite ore finer, which bauxite is the source of most aluminum, and these smelting plants in which you have aluminum used in fertilizer plants, you can have high levels of aluminum contamination of the workers. One of the first demonstrations of just how toxic aluminum was to the brain occurred in the early 1970s. And this was doctors working in dialysis units noticed that several of the patients were becoming severely demented and that they couldn't exactly pinpoint what was causing this dementia. They all seemed to be treated the same, but some were developing jerking spastic muscles, hallucinations, and this very rapid onset dementia that would occur. Well, they eventually discovered that because they were using tap water in the dialysis process, the high aluminum content in the tap water was entering the patient's bloodstream and subsequently the brain, producing this dementia. Aluminum gases can also enter the body quite easily, for instance in smelting or in atmospheric aluminum where you have waste dump burning various wastes that contain aluminum. These gases are absorbed very rapidly through the olfactory nerves. It's the smell nerves in the upper part of the nose, the mucosa of the nose. And this can be transmitted directly into the brain, the part of the brain that has to do with learning, memory, and behavior, so that you have elevated levels of aluminum in the hippocampus, prefrontal cortex, amygdala, and entorhinal cortex of the brain. So we see that, in fact, this is a very ominous source of aluminum entry into the brain. When ingested, aluminum is poorly absorbed. Certain things make it where it's absorbed much better, and we'll discuss that in just a minute. But once the aluminum enters your blood, it's bound to what's called transferrin. Transferrin is a transport protein that transports iron in your blood, but it also transports aluminum as well. And this can bring it into the brain, deposit it in the brain, and make it where it will stay in the brain for prolonged periods of time. One of the observations was that it appears that a lot of the toxicity of aluminum is that it also increases iron deposition in the brain and various organs like the heart and the blood vessels, the lining of the blood vessels. So because it's transported by the transferrin, the iron transporter, it can cause this iron to be released into tissues. The iron triggers very high levels of free radicals and lipid peroxidation that is responsible for much of the damage seen in things like Alzheimer's, ALS, cardiovascular disease, atherosclerosis. One of the observations that's of importance to neurological diseases is that aluminum has a special affinity for myelin. That's the fatty covering of nerves. It's like the coating on an electrical wire. But aluminum tends to accumulate in there. It activates what's called microglia, produces an immunoexcitotoxicity reaction that can go on for years. And this is very important in the field of multiple sclerosis. In one study, they showed that the presence of aluminum increased the lipid peroxidation in this myelin fatty sheath some 72%. So people with multiple sclerosis have been found to have higher levels of aluminum in their myelin than people without multiple sclerosis. One of the other effects of aluminum is that aluminum competes with calcium. Calcium is the major cell signaling system for a great many reactions in cells for normal cell function. Aluminum competes with that calcium, so it interferes with that communication system inside of all types of cells. Aluminum also interferes with metal-dependent enzymes. That is, there are numerous enzymes, thousands of enzymes operating in your body to control everything from carbohydrate metabolism and fat and protein metabolism to function of your brain and your neurotransmitters. Many of these enzymes are metal-dependent. That is, they use the metal as a cofactor to make the enzyme work properly. And what the aluminum can do is displace those metals from the enzyme so that the enzyme does not work as well. And this is a common finding. One of the ways that plants protect themselves against aluminum is they have an organic acid called citrate. It binds with the aluminum and helps prevent this toxicity inside of the plant itself. Of equal concern is an enormous body of evidence collected over the past 20 years connecting glutamate accumulation in many of the neurodegenerative type diseases. And interestingly, it's been found that aluminum binds very avidly to glutamate. And when it binds to the glutamate in food, it's rapidly absorbed through the GI tract. Remember, aluminum is not very well absorbed as a metal by itself, but when it's combined with glutamate, you get very high absorption of the aluminum, and aluminum is placed inside of the brain itself and produces toxicity in the brain. That is, both by the aluminum itself and by excitotoxicity. So this is something that you need to be aware of. Now, I often tell people that I go to restaurants with, I said, well, when you get your tea, don't get lemon and squeeze the lemon in your tea. And that's because it's known that the citrate from the lemon can drastically increase the absorption of aluminum into the bloodstream as much as 7 to 11-fold. In one test they did in men, they found that the addition of citrate to an oral dose of the antacid aluminum hydroxide gel increase the absorption of the aluminum from the antacid as much as 11-fold. So this enhancement of absorption is something that you have to keep in mind. Now, tea itself, particularly black tea, has a very high level of aluminum, and that's because the plant takes the aluminum up from the soil and deposits it in the tea leaf. White tea and green tea have very little aluminum content. The lowest is in the white tea. So we need to keep these things in mind when we're out eating in restaurants or eating at home, drinking tea. We need to think about these things that enhance the absorption of that aluminum. Teas, cheese, acidic vegetables, soft drinks, and aluminum cans all can increase your aluminum intake. You should avoid eating fruit or drinking fruit juice in combination with these things because it increases the aluminum absorption. Cooking acidic produce in aluminum pans certainly should be avoided because the acid leaches out the aluminum and deposits in the food. And, of course, things that you may not even think about, like a keg of beer. Most beers in aluminum kegs, some of them have linings in it, but these linings get damaged, and the acidic nature of the beer can leach out the aluminum into the beer. And when you consider that over the last 2 generations, the consumption of beverages from aluminum cans and containers has increased not only in teenagers, but we found that it's drastically increased in the older age group, people over 50, 55 years of age, as well as much younger children are drinking out of these aluminum cans. Now, most of these aluminum cans have a liner in it, a plasticized liner, but these liners get damaged, scratched during transport, and it can leach the aluminum into that drink. Now, what about links to neurodegenerative diseases? Well, an interesting study that was done in England, some 88 counties in England and Wales, they looked at the incidence of Alzheimer's disease and its relationship to aluminum levels in various districts, mainly through the drinking water. And what they found is that areas with high aluminum water levels had an Alzheimer's disease incidence that was 1.5 times higher than areas in which there was low aluminum content. Another study was done after that because of criticisms of how that study was done. This involved 2,792 people, and they found that population of elderly people who drank water with high aluminum levels demonstrated an incident Alzheimer's disease that was 4.5 times higher than the population whose drinking water had lower aluminum levels. So this was pretty powerful evidence that the aluminum was having a promoting effect on development of Alzheimer's disease. The supporting evidence came from studies indicate that people who use aluminum-containing antiperspirants were at a modestly increased risk of developing Alzheimer's disease as well. Another involuntary experiment involved mining industry. It has long been known that an aluminum can inhibit the toxic effect of silicosis. So in the process of mining silicon, the silicon dust is very thick in the mine, and the miners were breathing it, and it was producing silicosis, which is damage to their lungs. So the owners of the mines back in 1944 until 1979 had an ingenious way, they thought, to protect their miners. And what they did, after each shift, the miners would inhale aluminum dust from what was called an aluminum bomb, which would explode in the center of the room. It was just sort of a explosion just enough to fill the room with aluminum dust. And that was designed to bind the silicon so that it would not produce this silicosis. Well, what was discovered, mainly by the families of these miners, they began to see immediately that their big, strong husbands were starting to have a severe weakness. They were losing their muscle mass. They were becoming quite sick. They were having difficulty thinking. Their memory was impaired. And it was obvious they were developing these neurological disorders. And so they eventually linked it to the aluminum that they were breathing in these mines. Now, when we look at the different, just as a summary of what aluminum does to cells, number one, it increases the release of free iron, as we talked about. It increases free radical production and lipid peroxidation. It increases pro-oxidant copper and chromium effects. That is, it makes other metals more toxic. It impairs the membrane function, that is, membranes around cells and inside of cells, which are very important to cell function. Decreases the total lipids, glycolipids, and phospholipids inside of plant cells. These are important for all the functions of a cell. It impairs enzyme function and a number of types of enzymes, such as enolase, myosin, cowpain. These are interfered with by the presence of aluminum. It increases brain glutamate absorption and brain glutamate levels, and that triggers this excitotoxicity reaction. It's neurotoxic when combined with fluoride, and what we find is when you combine fluoride and aluminum, it produces a fluoroaluminum compound that was infinitely more toxic than the fluoride alone or by itself. In fact, it damages the small blood vessels that feed the brain that's so critical to brain function. In very small doses, far less than the amount of fluoride added to the drinking water, has been shown to produce this severe damage to the microvessels of the brain when combined with aluminum. And remember, drinking water has aluminum added to it. It's associated with Parkinson's, Alzheimer's disease. It can produce the pathological changes, the microscopic changes we see in these diseases, and it depletes brain lipids. Now, one of the interesting things that was discovered in this link to dementia and Alzheimer's disease, they knew that boxers have frequent dementia. They call it dementia pugilistica. And this is a rather rapid loss of ability to remember and to the point that they become debilitated. And what they did, they studied the brains of some of these boxers that had died and measured the aluminum levels using some very high-tech equipment. And what they discovered is that just like the Alzheimer's patients, the dementia pugilistica patients had very high aluminum levels. And this seemed to answer the question of why some boxers get this dementia and others don't, not just related to the number of blows to the head. Now, when we look again at the effect on the cell, we have to recall also that it's doing so many things that are deleterious to a cell all at once. It's interfering with enzymes, it's increasing iron levels, it's producing high levels of free radicals, lipid peroxidation products, it's interfering with the formation of neurotransmitters, it's triggering excitotoxicity in the brain, it's doing so many things to so many organs, heart, lung, the reproductive organs, the gastrointestinal tract, the immune system, and all of the nervous system is producing so many effects at once. This is why you see patients that have so many things wrong with them when they're aluminum toxic. And of course, the toxicity depends on the absolute concentration of the aluminum in the tissues, what other toxins are present. In other words, do they have cadmium poisoning also, or cadmium elevated levels, mercury, etc.? So these things interact. Other diseases interact with it. So if the person has, for instance, rheumatoid arthritis at the same time or has pulmonary disease, that makes this toxicity even worse. So all of these things are interacting to make this toxicity much worse than it would be otherwise, so that a young, healthy person is far less affected than an aging person, and particularly an aging person who has one or more chronic diseases. Exposure to multiple toxins, pesticides, herbicides, also increase the toxicity of these metals. And you have to remember that many pesticides and herbicides also contain aluminum and various type metals. You need to also look at your medications, because a great number of prescription medications, over-the-counter medications, add aluminum to it. For instance, if you look on the label and you see a blue lake or aluminum lake, which is just used to color the tablet, it has no function in the medicine, just to make the pill look pretty. And what that does, that's adding aluminum to the medication. So this needs to be kept in mind as well. Look at your medication and see if it's a source of aluminum as well. Now, what can you do to reduce the toxicity of aluminum? Well, number one, of course, is obviously exposure. So you don't use the aluminum foil, drink out aluminum cans, cook in aluminum cookware, etc. These are the kind of things that you need to always be cognizant of and be careful to avoid. Don't use aluminum-containing antacids. This was a big source, and it took decades before the medical profession finally woke up to the fact that patients were getting severe aluminum toxicity from antacids. In fact, recently, the doctors were telling their female patients, you need to take this antacid that has aluminum in it for your calcium source. Well, that's also a source of toxic aluminum. So you need to do those sort of things. Step two, of course, is your antioxidant protection. You need to increase all of your antioxidants. I call it an antioxidant network. That is your vitamins, your antioxidant minerals, your flavonoids. Eat lots of vegetables in particular. The vegetables have flavonoids in it that are very powerful at inhibiting the damaging effects of these aluminum compounds. We know that people that are low in calcium intake and low in magnesium intake have much higher sensitivity to the toxic effect of all metals, but in particular aluminum. And that if you supplement mainly with magnesium, less so calcium, it'll help protect you against this aluminum toxicity. Vitamin C, particularly the buffered vitamin C, magnesium ascorbate is the best. It tends to reduce the toxicity of the aluminum. It's important to always take your vitamin C on an empty stomach between meals because vitamin C will drastically increase the absorption of iron, and you don't want that. And of course, you want natural form vitamin E, that is, contains all 4 forms of the tocopherol and all 4 forms of the tocotrienol. That's the way it occurs in nature, and it has the most powerful effect in protecting you. N-acetyl-L-cysteine will increase the level of glutathione in the cells, particularly brain cells, and this is highly protective. And of course, you by taking your antioxidants along with your N-acetyl-L-cysteine, that keeps it in the reduced form, which is the functional form. Alpha-lipoic acid is a very important antioxidant. If you're going to take calcium, I would recommend taking calcium pyruvate because the pyruvate helps block excitotoxicity, and the calcium will help reduce the toxicity of the aluminum. Recently, what's been discovered is that saffron, the extract which you can get as a supplement, saffron is very good at binding and neutralizing the toxicity of aluminum, particularly in the brain. And curcumin also binds aluminum and reduces its toxicity again very well inside of the brain because curcumin enters the brain very easily. And it's been found that curcumin tends to focus its concentration in the brain on the areas of the brain most damaged by Alzheimer's disease and Parkinson's disease. Magnesium is important. I would use the magnesium malate, the time released. As you raise your tissue magnesium levels, that significantly reduces the toxicity of aluminum. So I hope you've gotten some useful information from this podcast about how to avoid and protect yourself against aluminum toxicity. I thank you for listening. The information contained within these programs is not intended to replace or contradict that of your physician. This information is for educational purposes only.